Hi, good evening. Welcome back. So, yesterday we had a session on growth in children, and following up on that, today we'll be discussing development in children. Both are very important topics, and you can follow up the recordings on the channel as well. So, what do you mean by development? Development is just the maturation of the individual, especially from the nervous system point of view. So it's a continuous process of maturation from the fetal life to adulthood. It's a combined outcome of nature and nurture, as we will review. There are huge changes in the first 3 to 4 years. We actually learn more than the first 3 to 4 years than any time in life after that. And especially the first 2 years where we learn a lot without even realizing we are learning. Early diagnosis of deviations from normal may help us to channel the development in the appropriate way. So it's very important to identify the conditions where there is a risk for development, and we can focus on early intervention, which has been shown to help, especially in the babies with birth asphyxia or premature babies, and we can channel the development in the right direction. So we reviewed the physical growth and mental development or neurologic maturation follows a progression. So the child is growing, and you also see the transition in different stages of the development. You can see the milestones progressing as well. So it's very important that we continue to support the child's development as best as we can as we go on with the maturation. The neonatal brain weighs 350 grams. It triples in size by 18 months, and by 7 years it reaches the adult size of 1350 grams. So you can see that the first 2 years is a critical phase. The 18 months is less than 2 years actually. So if you say triples, it's crossing 1000 grams by 18 months. It becomes like 1100 grams by 2 years of age. And then the final size is not far from the 1350 grams. So it's very important that we support the nutrition, the development, avoid things like the screen time, which can affect the child's development in the crucial 18 months to 2 years of age. And of course, there is the first 1000 days from conception to the first 2 years. So this is a critical period. So whatever the mother does in terms of nutrition, her health, her stress levels, and these will impact on the child's development as well. There are a few principles of development which applies to most species, including humans. So the development always progresses from something which is simple to achieve to a more complex stage. And there is also a cranio-caudal progression. So the head control comes first, the back starts straightening, then the child can sit, and then the walking comes. So this is the cranio-caudal progression. We also have maturation from the center to the periphery. So the fine motor using the hands and building objects and things like that, it comes after you have stabilized the proximal part in the shoulder, the trunk, the head and neck. So obviously the head control comes first. Then you have stability of the trunk, then the what we call the upper limb girdle, then the hands get control. And the development also progresses from something general, which is like waving the hand in excitement, to specific where the child points to an object and gets happy. Within the same field, you may have sequential development. The sequence is reasonably fixed, but there may be variations. And the speed of development may vary. There are common variations. For example, a child may crawl or may not crawl, and bottom shuffling pattern can be seen in the children who don't crawl. And typically the children who are shuffling on their bottom, it tends to be in the family, and they also have a delay in walking in most of the situations. The rate of development may be different in different fields. So we will be looking at what the different fields are. For example, the fine motor may grow at a different pace to the gross motor milestones. The child may start walking before they can develop a pincer grasp, or it may go the other way around. A child is very adept at finger usage of the finger, but they are lazy. They don't want to stand up and walk. And in girls, the language development goes ahead of the other fields compared to boys. So this difference in rate of development may be called dissociated development. There is a range, obviously, depending on your stimulation and things. So a child who is more stimulated by the older siblings to run around may do better in the motor tasks than one who is always sitting at home and watching the television, so they don't do well in the motor aspect. So this is due to the stimulation aspect. But if it's going beyond a certain range, then the dissociated development may have warning signs. For example, if a child has tone abnormality in the legs due to cerebral palsy, for example, their walking may be delayed, while if their intelligence is bad, they may actually be able to speak, and their fine motor may not be affected if the upper limb is not affected. So what are the different fields of development? So you have physical development, which involves gross motor and fine motor. So the fine motor has the gross and fine manipulative skills. So most of the tasks we perform as we develop or advance is related to the fine motor. So threading a bead, cutting with the scissors, writing, these are all fine motor, and it involves a lot of coordination. Sensory development involves vision, hearing, smell, touch, taste, and proprioception. Obviously, the coordination of the hands and the eyes is important for most of the fine motor tasks. So maturation of the vision proceeds at the same time. And language development is very important as well. And you have three components of the language. You have the receptive speech, where you receive the language input and understand what's happening. You have the expressive speech, where you learn to express what you want to say, and articulation, where you have to put the expressive speech. The thought comes to your mind, but unless you articulate or speak it, you won't produce the sounds that convey the meaning. And obviously there's a lot of environmental factors. The nurture component comes a lot in language development, and this is one of the most important areas where we should stress on avoiding screen time. So the same applies. Cognitive development is related to intelligence. Emotional development is related to how the child copes with the maturation process, their understanding of the world. There are different theories for how to focus on these understandings. So you have, as a child develops, abstract reasoning and concrete reasoning develops later on. So the way the child perceives the world, the child perceives the word punishment, the child perceives separation from the parents, all this is different. So they have a magical belief as well. So sometimes you should be careful in how you deal with difficult situations in a child's life, because their understanding is different from how we see it. We have social development, where the child understands how the rules are placed in the society. So the role play in games, how the child follows rules, whether they are disruptors in the school. So these aspects come to social development, and a lot of social development you develop from a role model. So it's very important that the parents play very good role models for the children. So we have moral and spiritual development as well. That again depends on where you grow up and how your family culture is. So there are many factors that affect development. So you may have prematurity, which is one of the most important risk factors as more and more extreme premature babies are surviving. So in prematurity, we are more worried about the babies who are less than 32 weeks. The babies more than 32 weeks mostly develop normally or within the normal range, even though there are many studies which show that a higher proportion of them may have problems. Still, compared to the general population, they develop reasonably well. However, because the larger proportion of prematurity comes in the late preterm babies, they do contribute more to the children with developmental problems. Neonatal illnesses like those affecting the brain, sepsis, meningitis, and birth asphyxia or HIE. Socio-economic status plays an important role. If the parents are educated, if they're affording support, the children tend to do better. Family environment, whether there is an opportunity for the child to play and stimulation, are really important. So typically a family which doesn't encourage physical activity, where there is a lot of television viewing, where the nutrition is not adequate, the stimulating environment is not there, the children tend to lag behind. Nutrition in the early days is very important, and adequate protein intake is important as well for brain development. Iron has been shown to be a very important nutrient for brain development, and that's why iron deficiency in the first 6 months to 1 year should be avoided to optimize your development. So we categorize milestones as a certain achievement of the child at a certain age, and the achievement of these milestones is based on sequence of events in each field. I mentioned the different fields of development. There is a wide range of normal, and each child may differ. As I said, there may be dissociation between the different fields. A progress in development in the individual fields is important. So the child is sequentially following a pattern, even if there is a slight delay. If over the next month or so the child is making progress in that field, it's less concerning than a child who stagnates. There are also conditions where there may be regression, where a child attains a milestone, but after 2 or 3 months, the child loses that particular milestone. So a certain degree of regression happens in autism, for example, or you may have the more severe neurodevelopmental disorders where there is regression of milestones. A problem affecting individual fields can lead to delay in other fields. I mentioned the correlation between vision with fine motor, and hearing problems can affect language, for example. And we have definitions for important milestones within an expected age range. So there is always a range within which to attain. So don't go by a pinpoint that you have to smile at 2 months. A child can smile up to 3 months, for example. And if it's a premature baby, you need to remember that you need to correct for their prematurity. So especially the babies below 32 weeks, the period of time by which they are premature, that is added to their that is reduced from their chronological age to give the corrected age. For example, a 32-weeker, you may reduce up to 8 weeks from their current age and compare them with children of that age. So it's very important that we have routine child surveillance to pick up developmental problems. So you have the newborn period, when we of course assess the child for any problems. 6 to 8 weeks, I told you yesterday with the growth that we assess the child at 2, 4, 6 months usually with the vaccination. So the similar schedule can follow for vaccines and development and growth as well. And then you should have an assessment of hearing within 6 months. If the screening is not done, you should formally assess the hearing as well. And by 18 to 24 months, a child dental review is important as well. And a formal vision testing should be considered at the preschool age in all children. If you don't have it routinely, you can seek it out. If there is any concern, of course, you have to test the vision earlier. You can see here that's a wide range of normal. So this is the normal range. And then you have the slow but steady progress where they are progressing. These may be the low achievers, or they may catch up to do well later in life. And some children, either because of socio-economic reasons or bereavement or something like that, they plateau, they don't continue growing, or they might have developed an insult to the brain which affects their brain development. And then you have the regression, which is very rare. So the child develops milestones which they lose. So these are usually very serious, and you have to be paying attention to that. You can see here that the gap between the normal and the abnormal becomes wider. So it's easier to pick up abnormality as a child gets older. So by school age, the abnormalities are easier to pick up. However, when they are younger, it's very difficult to pick up the differences. So you may end up worrying the parents for problems which are actually in the normal range, or you may miss problems unless you are looking specifically for certain aspects of their development. So there are certain things we look for at certain ages. So in the newborn period, the child starts regarding the face. The vision is developed in the newborn period itself, and the child can see the objects which are nearer to the baby. So the focal length is adjusted in such a way that the baby can see the mother's face clearly while they are feeding, and they do have color vision as well. So it's very important that we assess their visual assessment from a closer distance. As the child matures, binocular vision develops and distant vision develops as well. The child starts responding to voice. There may be primitive reflexes like sucking, swallowing, rooting, development of the grasp and other reflexes. So these primitive reflexes tend to wear off as the more advanced reflexes come on. So the loss of primitive reflexes is a very important aspect of child development as well. The gross motor development in the first year, you achieve head control by 6 to 8 weeks, and by 4 to 5 months can start sitting with support and can start turning from back to side. By 6 to 8 months, the child sits without support and can roll from back to stomach. By 9 to 10 months, the child can crawl and start standing with support and walks by 12 months. So this is the sequence, so rolling over and going on the knees, sitting, and then they can start standing and walking. So the stage of development can guide you in terms of what you should do for the child. So when the child has started sitting with support, you start considering a high chair. This is usually the time we start weaning the child, so it would help you with the feeding as well. When the child enjoys sitting with support and looking around, and they start developing more, the stimulation is more, of course, not to watch television. Avoid the baby walker. There is really no benefit, and it can cause harm by accidents, or it may cause toe walking, so they may have a delayed walking. So avoid the baby walker. You have more developmentally appropriate toys according to the age. In terms of vision and fine motor in the first year, you have fixing and following by 6 weeks, and by 4 to 5 months the child reaches for toys. By 6 months they reach for toys and have a palmar grasp. They also start transferring from one hand to the other, and they start putting the toys in the mouth. By 7 to 9 months there is a crude pincer grasp developing, and by 12 months there is a fine pincer grasp. So these are very important milestones, and by 12 months they start releasing objects as well. So the pincer grip is where the child can particularly pick with the thumb and the index finger, and very small objects can be picked up. The language, in the first 6 weeks the child engages in vocalizing, 3 months cooing and laughing. Remember that even a deaf child can start cooing, and that's a imitating performance. By 6 months the child babbles, more complex sounds can turn to sound, and by 9 months there is 2-syllable words like mama, dada without meaning, and by 12 months there is words with meaning. And of course, as a child becomes older, your task development becomes complex. I'm not going into the detail of this. And the important features, by 2 to 6 years, you have climbing stairs, jumping, hopping for gross motor. And then for the fine motor, you have refining of the grip. They can draw shapes. So by 2 years, you can draw a vertical line. And by 30 months, they can imitate a circle. And they can make a horizontal line by 3 years. Copies circle by 3 years, copies a cross by 42 months, and can draw a square by 4 years, and a diamond by 6 years. So visuospatial tasks, improving coordination so they can catch a ball, building structures with cubes. So this depends on practice and maturation as well. And jigsaw completion, fixing of form boards, these are good ways to assess their understanding. Increasing independence starts, and they start exploring more, and increasing muscle power and tone happens as well. So important features at 2 to 6 years, we have receptive language and vocabulary increases, the sentence structure is more elaborate, and in terms of cognitive skills, attention span improves, selective attention improves. Bowel, bladder control and toilet training usually start by 12 to 18 months. Some parents try to start early, but too early starting is more like conditioning rather than training. And very important that we encourage play, so the societal rules start getting established by that time, and the child starts playing in groups and learning rules, and formal education begins as well. Let's pause for a brief second. Sleeping? No, I was doing something. Everything's okay. Very kind.
Vegetarian, or vegetarian? The salt, because we cannot check the salt and all.
I have some. Thank you. I told you that's why first time I'm doing something meeting. Sorry for the interruption. So here a child is playing, building blocks. So this is the form board where they start recognizing different shapes, and this is a very good developmental toy. It's easier than the jigsaw, so the child can start fitting the form board right from 12 to 15 months according to their maturation. and these are wooden blocks. Usually they're quite easy for the child to play with. So it's very important that the child has key milestones monitored by the pediatrician or the GP whenever there is a review with the doctor. I mentioned earlier about holistic care. So we should discuss safety, we should discuss development, we should discuss healthy parenting, and we should discuss dental care and so on. So the children with risk factors need close follow-up, and you may have early intervention therapy. Some studies show a benefit from early intervention. We should have a system to assess hearing and vision. A support system for children who are picked up as having abnormal development is important as well. There is a whole spectrum of developmental disorders. So we have normal development, which is of course a wide range as well. You have simple developmental delay, where you may have possible mild learning difficulty. Cerebral palsy is a movement-related problem, more commonly after birth asphyxia or prematurity. There is mainly a motor delay, and you may have neuromuscular problems in mild CP. And I mentioned the neurodegenerative conditions. You may have genetic conditions or familial conditions which lead to mental retardation or learning difficulty, and hearing vision related problems also impact on overall development, and many of these problems have seizures as an association. And you may have coordination problems like clumsy child or apraxia. You may have selective learning difficulty like dyslexia, where you can't identify letters or read. And you have pervasive developmental disorders, which of course is a whole spectrum by itself, like autism. The approach to management involves a family-centered approach. We should educate the family that there is a problem. It involves a multidisciplinary input from pediatrician, physiotherapist, occupational therapist, speech and language therapist, play therapist, and learning support coordinator. There is a child developmental pediatrician and neurologist. Orthopedic doctors may be involved as well where there is a problem. So the investigations would depend on the clinical picture. Most of the time you have the history to point out to the reason, and then the special findings may lead to investigations or tests. There are special schools which help the children with significant learning difficulty. You need regular monitoring of the development. The parents need a lot of support. Sometimes they need respite care because it's very challenging to look after a child with developmental problems, and these are better managed in countries with good social support systems. Unfortunately, in the developing countries, it's lacking, and it's a great strain on resources as well. So to summarize, monitoring of the infant and child development is very important, and if there are concerns, the parent should understand the normal sequence of development. They should seek help at the right age, and appropriate management is important as well. So let's see if you have any questions. So I have a couple of thank you messages. So thank you for watching it as well. And I'll just wait a minute for seeing if any questions are there.